7 signs of a heart attack. A heart attack, or myocardial infarction, occurs when blood flow to a section of the heart muscle becomes blocked, preventing it from receiving the oxygen it needs. This blockage is usually caused by a buildup of fatty deposits, cholesterol, and other substances in the coronary arteries, a condition known as atherosclerosis. If the blockage is not quickly resolved, the affected part of the heart muscle begins to die due to a lack of oxygen. Heart attacks can happen suddenly or develop gradually over time. Some people experience intense symptoms, while others may have only mild or atypical signs. Women, older adults, and individuals with conditions like diabetes may not experience the classic chest pain associated with heart attacks, but instead suffer from more subtle symptoms like fatigue, nausea, or shortness of breath. Recognizing these warning signs and seeking immediate medical attention can be life-saving. One of the most common warning signs of a heart attack is chest pain or discomfort, which can feel like pressure, tightness, squeezing, or burning in the center or left side of the chest. This pain is caused by ischemia, a condition where the heart muscle does not receive enough oxygen due to a blocked artery. Unlike stable angina, which is triggered by exertion and relieved by rest, heart attack pain persists even at rest and does not go away quickly. The discomfort may last for several minutes or come and go in waves. The pain from a heart attack is not always confined to the chest. It can spread, radiate to other areas, including the left arm, shoulders, neck, jaw, back, or even the stomach. This happens because the heart shares nerve pathways with these regions, a phenomenon known as referred pain. The brain may misinterpret the pain signals, leading to discomfort in areas unrelated to the heart itself. Some people, especially women, may experience jaw or upper back pain instead of chest pain. Feeling short of breath or struggling to breathe, even without physical exertion, can be another sign of a heart attack. This occurs because the heart is not pumping efficiently, leading to a buildup of fluid in the lungs, pulmonary congestion. As a result, oxygen exchange is impaired, making it difficult to breathe. Shortness of breath may be accompanied by wheezing, a feeling of suffocation, or difficulty lying flat. This symptom can occur before, during, or after chest pain and is particularly common in women and older adults. Profuse sweating, especially cold and clammy sweat, is a lesser-known but serious sign of a heart attack. This occurs due to the activation of the sympathetic nervous system, which triggers a fight-or-flight response in reaction to the heart's distress. The body releases stress hormones such as adrenaline, which can cause sudden sweating, dizziness, and increased heart rate. Unlike sweating from exercise or heat, this type of sweating happens suddenly and without an obvious reason. Some heart attacks, particularly in women, may manifest as digestive symptoms like nausea, vomiting, bloating, or indigestion. This happens because the vagus nerve, which controls digestion, is closely connected to the heart. When the heart is in distress, it can trigger a sensation of nausea or discomfort in the upper abdomen. Many people mistake this symptom for food poisoning, acid reflux, or a stomach virus, leading to delayed medical attention. A heart attack can cause a sudden feeling of dizziness, weakness, or fainting, syncope, due to reduced blood flow to the brain. When the heart is not pumping effectively, blood pressure can drop suddenly, leading to a lack of oxygen in the brain. This can result in feelings of confusion, loss of balance, or even temporary loss of consciousness. Dizziness and lightheadedness are often accompanied by other symptoms, such as chest pain or shortness of breath, but they can also occur on their own. Unusual and overwhelming fatigue can be an early warning sign of a heart attack, particularly in women. This is caused by poor circulation and reduced oxygen delivery to muscles and organs. Fatigue related to heart issues is often described as unrelenting exhaustion that does not improve with rest. Many people report feeling drained or unusually tired in the days or weeks leading up to a heart attack. If you experience extreme fatigue that is persistent and unexplained, it is important to seek medical evaluation. Some people hesitate to seek medical help, assuming it's just indigestion or stress. A delay in treatment can be fatal. Yes, these symptoms are not exclusive to heart attacks and can also indicate other medical conditions, including gastroesophageal reflux disease, GERD, can cause chest pain and indigestion. Panic attacks can mimic heart attack symptoms, including chest pain, shortness of breath, and sweating. Muscle strain or costochondritis can cause localized chest pain. Lung conditions, for example pulmonary embolism or pneumonia, can lead to breathing difficulties and chest discomfort. Anemia or dehydration can cause fatigue and dizziness. While these symptoms can be due to other health issues, it is always better to be cautious and seek medical attention if you are unsure. A medical professional can perform tests such as an electrocardiogram, ECG, blood tests, or imaging scans to determine if the symptoms are heart-related. This information is for educational purposes only and should not be used as a substitute for professional medical advice. If you experience any of these symptoms, seek immediate medical attention. Recognizing the warning signs early and acting fast can save lives. If you are at high risk for heart disease, talk to your doctor about preventive measures and regular checkups.